Good afternoon, everyone. My name is Komal. I have done my master's from Jamia Hamdard University, and today my research topic is role of dynamic neuromuscular stabilization on functional mobility in occupational therapy. A scoping review. Dynamic neuromuscular stabilization is a rehabilitation approach based on developmental kinesiology and reflex-based core stabilization. It engages the deep stabilizers of the trunk, diaphragm, obliques, and transfer abdominis by retraining ontogenic movement patterns. Within occupational therapy, functional mobility refers to the ability to transition between positionings during daily tasks, bed mobility, transfer, ambulation, and object transportation. These movements are foundational to independence in activities of daily living or instrumental activities of daily living. DNS holds potential in occupational therapy by improving movement quality and postural control, enhancing the integrated spinal stabilization system. Supporting core goals of occupational therapy is uh, independence, functional, and quality of life. Objective of the study was to explore the scope, range, and nature of existing literature on the use of dynamic neuromuscular stabilization in occupational therapy, with a specific focus on impact on mobility, functional mobility. Methodology of the research was database searched, Google Scholar, Scopus, PubMed, Cochrane Library, and BNC. Search keyword was dynamic neuromuscular stabilization or DNS, occupational therapy, and functional mobility. Inclusion criteria was DNS as the core intervention, population relevant to OT like neuro, ortho, or pediatrics. Outcome involves mobility, posture, or ADLs. Exclusion criteria was study lacking functional outcome measures, DNS solely used for athletic performance. A Prisma guideline was used for screening and selection as shown in the flowchart. Evidence supporting DNS for functional mobility. Neurological rehabilitation stroke. 8-week DNS program significantly improved balance, quality of life, and postural adjustment time. In multiple sclerosis, DNS improved balance, postural stability, walking ability, and reduced fall. In Alzheimer's, DNS improved gait and balance, which enhance daily functional movement. In cerebral palsy, evidence shows improved muscle activation, balance, and walking abilities. In overweight or obese individual, DNS improve functional capacity, supporting mobility in population with weight-related movement limitations. Functional movement in general population. DNS training shows superior result on traditional fitness, notably in dynamic balance, while balance test was used, and overall functional movement quality. Relevance to occupational therapy. DNS support ATADL performance by restoring fundamental movement patterns, aligning seamlessly with OT goals for enhancing functional independence and mobility. Clinical applications. DNS can be incorporated in occupational therapy intervention, targeting bed mobility, bathroom transfer training, wheelchair mobility, functional ambulation. Goal setting of DNS enhance functional mobility. Occupational therapy can incorporate DNS principle into SMART, which is specific, measurable, achievable, relevant, and time bound. Future recommendations. and research gap. Despite promising outcome, limitation in DNS research include insufficient OT-specific protocol, most intervention led by physiotherapists or general rehab team. Lack of long-term data, follow-up periods are short, effects over time are unclear. Limited practice-based evidence need to be more case studies and trials in actual OT practice. Recommendations: develop OT de- developed OT DNS protocol tailored to OT settings, encourage interdisciplinary DNS training or occupational therapists, conduct RCT with OT-led intervention, measuring functional outcomes. Discussion: finding from the literature indicates DNS enhance motor control, postural alignment, and biomechanical efficacies, all of which are vital to functional mobility. Yet its adopts in occupational therapy remains limited due to a lack of formal OT integration. Literature measure occupational therapy minimal therapist reported implementations. There is a strong case for greater collaboration, protocol development, and training to bridge the gap. Conclusion of the research was dynamic neuromuscular stabilization is a promising therapeutic approach that addresses the root of functional mobility issues through core stabilization and movement pattern correlation. Its alignment with occupational therapy principle makes it a viable strategy for enhancing ADL and IADL performances, promoting independence, improving quality of life for client across diagnostic categories, greater incorporation of DNS into OT practice, supported by robust research and interdisciplinary collaboration, could enrich functional mobility outcomes and expand the scope of evidence-based occupational therapy. These are my references. Thank you.